Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of April 2026 includes stories about a new study on the origins of rheumatoid arthritis, highlights from the Pharmacy and Respiratory Therapy Research Days, and midwifery students push to bring services to more Manitobans, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. Arthritis Society Canada has awarded $450,000 to a U of M researcher for a project aiming to help patients and physicians better understand rheumatoid arthritis. Dr. Liam O'Neill, Assistant Professor of Internal Medicine at the Max Rady College of Medicine, said rheumatoid arthritis affects about 1 in 100 people in Canada. His team has discovered a protein modification in rheumatoid arthritis that could help better understand the origins of the disease and why it starts in certain patients.
What we found in our research lab is that this modification appears to affect the activity of certain enzymes. We're very interested in these enzymes. They come from a white blood cell called neutrophils. And what we found is that when we induce this modification on these enzymes, what happens is the enzymes become more active and they become more stable. And so with the activity part of it, we think that this may be why certain patients develop joint damage in rheumatoid arthritis, which is a major problem when you get inflammation that's uncontrolled. And the stability part of it may also influence the joint damage, but we also think that it might influence autoantibody production itself. And so really the project is looking at expanding on some of these observations that we've made, associating them with patient outcomes, and then studying them in a mouse model to understand what their role is in the development of rheumatoid arthritis.
Part of the 3-year strategic operating grant will allow O'Neill's team to work with a biobank of blood samples from patients and their relatives that have been collected over the last few years. He said the research could lead to new medicines that prevent joint damage by targeting altered proteins. The University of Manitoba's Master of Physician Assistant Studies program celebrated 15 years of innovative healthcare education at a gala on April 24th. More than 170 people attended the event at the Gates on Roblin to mark over 15 years since the first MPAS class graduated in 2010. Director of the program, Rebecca Mueller, spoke about what makes the Master of Physician Assistant Studies program special.
The University of Manitoba has historically been the trendsetter and believer in PAs. We continue to set that standard, including tonight. This is the first ever in Canadian history that a university and community are taking time to celebrate a PA program and its PAs in the community.
Manitoba has been at the forefront of integrating physician assistants, or PAs, into the healthcare system, and U of M has been a leader in PA education. In 1999, Manitoba became the first province to regulate and recognize PAs in Canada, and U of M launched the first master's level PA program in Canada in 2008. Minister of Advanced Education and Training Renee Cable told the audience that it was an honor to be there and to look at the current and future face of healthcare in Manitoba.
I love PAs. I need to get that out of the way because you have no idea how much I think that the work that you do is incredible.
To help meet the growing need for physician assistants in Manitoba, the program's class size increased from 15 to 30 students in 2024. The George and Fay Yee Centre for Healthcare Innovation, known as CHI, has secured $2.6 million in federal funding to strengthen patient-oriented research in Manitoba. The centre is jointly operated by the Rady Faculty of Health Sciences and Shared Health. The 2-year funding extension from the Canadian Institutes of Health Research will help strengthen collaboration among patients, families, caregivers, researchers, and health system decision-makers. Carly Leggett, Executive Director of CHI, spoke about what the funding means for Manitoba's healthcare system.
This funding extension is a really great opportunity for us to build on the work that we've been doing over the past 10 to 14 years. At the end of the day, when I think about the services and the support of the Center for Healthcare Innovation, we really believe that having people with lived experience of health conditions and of the healthcare system as partners in research is absolutely critical to ensuring that we focus on the problems that matter most to Manitobans. Ultimately, research is more accurate, it's more relevant, and it's more likely to be used when it involves the people that it will affect. And this is at every phase and every stage of the research process. So that can mean, from the design to the analysis and the interpretation and the sharing of the results. And so here at CHI, we provide services and support to researchers and across the healthcare system to ensure that that engagement is meaningful and authentic and valued, not just to the patients, but to the research teams themselves as well, and that the results of the research are ultimately used to guide policies and service design and clinical improvements that we see every day in the healthcare system.
The Bachelor of Midwifery program at the College of Nursing recently held its second annual exhibition of student proposals focused on addressing midwifery care shortfalls across Manitoba. The event took place April 9th at the Helen Glass Center for Nursing and is the central part of a third-year course in the program. The goal of the project is to identify equity-deserving groups or communities within Manitoba that do not currently have adequate or any access to midwifery services. Angela Nepinak and Emma Kolapo presented a proposal to improve midwifery care for Indigenous pregnant people who are forced to give birth outside of their communities, specifically in the Island Lake communities of St. Teresa Point, Garden Hill, Wasagamak, and Red Sucker Lake, which are accessible mainly by air or winter roads.
Our main goal is relationship-based care. So part of our proposal is we're going to have 4 to 5 midwives, and they're going to be rotating 1 week at a time going to the communities, like a hub in St. Teresa's Point, and then visiting the other communities during that week. So there will always be a midwife in community, building those relationships, building trust with community. They can get to know us, we can get to know them. Midwifery care is really all about building relationships with people.
The second presentation came from Louise Dirksen and Madison Trippier, who looked at bringing midwifery care back to the PAW. Trippier said that there are up to 450 births annually in the PAW and only one obstetrician available at any given time.
But yeah, essentially the whole point is to allow the women in the pod, in these rural communities, the choice of having a midwife. You should be able to choose what kind of obstetric care you want. Being forced to either accept the care that's in that community or have to travel to Winnipeg to have another source of care is not equitable. And that's the whole point of our project, to identify that.
Studies show that the inflammation of the female genital tract in postmenopausal women places them at an increased risk of human papillomavirus persistence, which is a risk factor for developing cervical cancer. Dr. Keith Folk, department head and professor of medical microbiology and infectious diseases at the Max Rady College of Medicine, said that when there's inflammation in the genital tract, that's an environment that HPV thrives.
So if we can decrease that level of inflammation, then HPV we can get rid of it, which is something that happens with this virus that doesn't happen with other viruses like HIV. Your body can naturally clear it.
Folk is leading a multidisciplinary team working on ways to fight human papillomavirus in older women to prevent cervical cancer. The project recently received $2 million over 5 years from the Canadian Institutes of Health Research. The first step is to decrease inflammation of the genital tract, and the team will test aspirin and hormone replacement therapy. Dr. Julie Lajoie, an assistant professor of medical microbiology and infectious diseases, said the aspirin could be a good tool for reducing inflammation because of its anti-inflammatory properties, and hormone replacement therapy is a treatment that many women are already using to relieve symptoms of menopause.
We are trying to use things that are already existing, that are already approved, that we know are pretty safe. So if that was to work, then starting to launch big clinical trial is a lot faster because, the phase 1, the phase 2, it's already on the market.
Lajoie said it's important to find a treatment because cervical cancer is the fastest rising cancer in Canadian women. The College of Pharmacy celebrated research excellence at its annual Research Day on March 12th at the Apotex Centre on the University of Manitoba's Bannatyne campus. The event opened with a Graduate Studies Award ceremony recognizing students for excellence in research, academics, and community involvement. Among the recipients was PhD student Sasha Kuhlman.
As I was going through my research journey, something that always struck me was the idea that scientists are kind of in the lab creating questions and answering questions, and these are really important questions to answer, but I always also wondered, what do people in the community want answered? Maybe what the people who would be impacted by the research that we do, what's important to them, what matters to them, and how can we as researchers partner together and use the skills that we have along with the lived experience and expertise that they bring to answer meaningful questions in a collaborative way. So the opportunity to do that as a PhD student, I get to not only learn through the research skills through Dr. Hudik and through being a student, but then I also get that real world perspective from our patient partners. And right now my research partners with youth and families with congenital heart disease to kind of reimagine the way that they transition from children's to adults' heart care.
The afternoon featured a keynote address by Dr. Jaris Swidrovich of the University of Toronto, who spoke about supporting Mino Bimad-Dziwin, the good life, through Indigenous research in pharmacy education and practice. Faculty and student research was also highlighted through a faculty research presentation and a student poster competition. The Respiratory Therapy Program at the College of Rehabilitation Sciences held its 6th annual RT Research Day on March 23rd at Bannatyne campus. The day featured 20 research presentations from students in the second year of the 3-year Bachelor of Respiratory Therapy program and 2 panel discussions with third-year students. The students presented a wide range of topics to guests attending in person and virtually. Second-year student Paul Tokar was one of the presenters. He spoke about the use of artificial intelligence to wean patients off ventilators and how that compares to conventional clinician-based strategies.
On the ventilator, we're the ones that are setting parameters to wean a patient. So when we're weaning, we want to get them off the ventilator as soon as possible, right? So we get them off because we don't want to increase their hospital stay. Increased time on the ventilator causes increased mortality, morbidity, and increased complications.
Tokar said that some AI is used on ventilators in Winnipeg, but that more advanced AI has been used in Europe and shown promising results. He feels more research is needed, especially for patients in intensive care that have obstructive diseases like COPD or asthma. Thanks for joining us today. Radius is heard monthly on UMFM 101.5, and all episodes are available for stream on Spotify, Apple Podcasts, and YouTube. Please send us any ideas and feedback to radiomarketing@umanitoba.ca. Read more about this episode's stories by reading the show notes or visiting our new UM Today news site at umtoday.ca.